Hello, this is Dr. Lewerenz. Today in my office I have some information here that I want to share with you that kind of hit me that I don't think it's a topic that I've covered before here on my channel. And please subscribe and follow us here at Longevity Health Institute, because we're always bringing you the best in personal functionalized root cause medicine. But I came across my desk today and a patient, and then actually a patient in a different way, and I'm like, I gotta talk to you about this because it's very underappreciated, very undervalued, and it's a huge, huge part of reducing pain in your body, but also something that's never really appreciated and looked at, and also something that actually really helps out your vasculature and your vascular health. And that is hormonal balance, and hormonal balance with balancing hormones, particularly estrogen. Now, most of the times you hear a hormone like estrogen and think of women. And yes, majority I'm talking here about women in the causes of estrogen in a pain reducing effect. But men too have estrogen. Now, as a man, we actually make testosterone. We don't make estrogen, but we convert it from testosterone in our body. And as we age, we tend to convert a little bit more, and too much estrogen is a negative thing you've heard me talk about in the past in other videos. But estrogen can be very, very, very anti-inflammatory, can be very, very, very loosening and tendon suppleness and anti-inflammatory effects on joints and bones. And actually, if you have too little of estrogen, and follow me here, a man, too low of testosterone, then you don't convert to estrogen, so you have too low of estrogen. So not only are you tired and lose muscle mass and grumpy and low libido and poor erections and risks for osteoporosis and cardiovascular disease, but you also are stiff and you also then have pain. Men and women need estrogen. Yes, men need very little of estradiol and estrogens, but it is something that needs to be evaluated and appreciated because estrogens can reduce pain. Estrogen can also make your vasculature and the glycocalyx of your endothelium, your vessels, stretchy. So it can actually lower your blood pressure and give you a more adequate, balanced, optimal blood pressure. Okay, so when you have actually higher blood pressure and you're older and you're stiff and your back stiff in the morning and your joints are stiff and achy, make sure that you reflect on and think of your hormones, not just estrogen. I just wanted to cover this one, but it's the one undervalued hormone that people don't often think about, especially if you're a man. Now, if you're a woman, you need estrogen. There's many benefits: bone protection, brain protection. And again, studies and clinical evidence show that it lowers blood pressure. I had a patient here today, that's why I'm talking about this today, that actually we put her on bioidentical hormones, we balanced her hormones. Obviously, we work on inflammation on her gut, on root cause stuff. She's doing much better. Second visit, her blood pressure is way down, so much down, she's tracking at home that she said, should I reduce or take off my blood pressure medicine? Because her pressures today were like 110/70. So it's something we're gonna track and follow, and maybe there's a possibility she can get off her medicine or reduce her blood pressure medicine. But very healthy for her, gives her the stretchiness and the elasticity of her vasculature, and she feels better and is doing wonderful. Again, men, we want to use it. We don't give estrogen, but we want to make sure we appreciate the balance of testosterone, other hormones, and estrogen, and it can actually reduce pain and lower blood pressure. So just remember that in a functional systems approach, looking at your physiology, one of the main systems that we look at in your body, one of the 6 main systems, and appreciate here at Longevity Health Institute, is your hormones. And yes, there's other hormones that affect, and you've heard me talk about, for pain reduction and vascular and cardiovascular protection. But always appreciate estrogen and its benefits. It's not all bad, and it doesn't just make you fat and make you risk for other things. You have to have some. Sometimes a little is just good enough. This is Dr. Lewerenz. Follow us here on YouTube. Follow us on Facebook. I'm always bringing you the best evidence-based, functional, personalized medicine, concierge medicine here. Me and my practitioners not only are board certified and certified in primary care and family medicine, but in functional medicine and root cause medicine, so that we can bring you the best of your possible health. Dr. Lewerenz here. Be well.